Hi, my name is Rhiannon. My informative speech topic today is going to be epilepsy. I've had plenty of time to live with this disorder and learn about it and do research on it. I have had it since I was 13. I've gone to many different doctors, been in and out of the hospital, unfortunately, due to it. But I have learned tons of different things about it, so I'm glad I get to share that with you guys today. So let's dive right into it, I guess. Anyone can get epilepsy, actually. 1 in 26 people can develop epilepsy in their lifetime, and about 1 in 100 people in the US have had an unprovoked seizure in their lifetime or have been diagnosed with epilepsy. Each year, 48 out of 100,000 people will develop epilepsy, and it's also the fourth common neurological condition and affects more than 65 million people worldwide. And one of the biggest reasons to listen to this is there's something called SUDEP, and it's known as sudden unexpected death of someone with epilepsy who is otherwise healthy. Every year, more than 1 in 1,000 people die from it who are epileptics with uncontrollable seizures. The best way to try to lower that is to try to control your seizures, of course. There are diets, epileptic surgeries, and neurostimulation devices, along with tons of other options that someone can discuss with their neurologist or primary care physician. And next we can move on to, so you think you had a seizure, but is it epilepsy or something else? Because sometimes even though you have a seizure, it may not be epilepsy. So if you or your loved one may have a seizure, but you're not sure if it's epilepsy or not, you can go see your primary care physician, and if they determine that it will be, or they may think it's epilepsy, they'll send you to a neurologist. And during the exam with a neurologist, they'll typically check your reflexes, like your motor skills and your senses. And this is determine whether your reflexes are kind of up to par, like are you reacting like you should. So the neurologist may also perform something called an EEG. So this is really important to diagnose somebody for epilepsy because it's going to record your brain waves and see if there's any unwarranted electrical activity showing up. And it's electrodes are going to be placed on your head by glue and attached to a small electrical box. And this is going to show up on a screen that kind of looks like a heart monitor. That's a vital step in diagnosing epilepsy. And for someone who's newly diagnosed, they're going to do most likely a neuroimaging scan, and this is just to make sure that there's no tumor growing or a malformation in your brain. So you know you officially have epilepsy. The good news is there is treatment options. So at this point, what you want to do is assemble a healthcare team. You're going to want to let your primary care physician know your new diagnosis. And you're going to want to get a neurologist that you feel comfortable with and you mesh well with, basically. That's your primary goal, because managing your epilepsy is a team approach. And of course, before you visit your new neurologist, the best thing to do is write your questions down. Because when you get in there, you can forget those. Those are important questions. Write them down. They're important. As this diagnosis is new, learning as much as you can about epilepsy is key to success when living with this diagnosis, whether it's short-term or long-term. Not all seizures are long-term. You can grow out of seizures. Depending on your epilepsy and how severe it is, your doctor may offer something called a vagus nerve stimulator. This is for drug-resistant epilepsy, and this can lessen or prevent seizures by sending electrical pulses to your brain through your vagus nerve. This device is implanted under the skin in your left chest area. However, this device does not have to be programmed, or it does have to be programmed, This device does come with a magnet, That way, if the epileptic or you or whoever do feel a seizure actively coming on, you just swipe the magnet over the device to receive an extra burst of electricity. Statistically, a review of 65 million people who have had the VNS for over 10 years or longer showed improvement in seizure control over time. So seizures decreased by 36% after 6 months, 58% after 4 years, and 75% by 10 years after the VNS was placed. So for milder epileptics, their diets actually. The ketogenic diet is often recommended for epileptics as their foods we cannot eat. This diet is a high-fat diet, low-carb, and is usually paired with your seizure medication. Your neurologist and nutritionist are going to monitor this and just make sure how you're doing with it. And with all things, there is first aid that comes with epilepsy. So you can, or you don't have to, let the people around you know that you have epilepsy, just for your safety. And that's if you feel comfortable with it. You can let your work, school, or friends know, and if you are prescribed a rescue medicine, you can also let them know that. A rescue medicine is something that tries to help prevent the seizure from occurring. And if you do have one, maybe your friends, family, etc. can try to administer that. So whoever it is, or if it's you in that case, you need to always stay with the person until the seizure is over. And if they are injured during the seizure, they may need help right away. Time the seizure. Please time it. If the seizure is longer than usual for that person, you need to call for help. And you need to remove objects out of the way to prevent injury. Roll the person on their side to prevent them from asphyxiation, like throwing up or choking on their own spit. Do not put anything in their mouth. They can't swallow their tongue, so support their head. Maybe put a pillow under their head, or if there's not one around, just maybe put your hands and try to hold their head so it's not hitting the ground. You don't want that to happen, as that can cause an injury. Don't hold them down, because it can prevent, or it can cause more injuries. The person may wake up confused, agitated, or scared. If they try to walk around when they wake up, just let them, as long as they are in a safe, enclosed environment. Of course, if you're out in public and they just had a seizure, you don't want that to happen. So just let them walk around if you're in an enclosed environment. And make sure their breathing is okay. During a convulsive seizure, most people know it as a grand mal seizure. It can look like the person has stopped breathing. This typically happens because their muscles have tightened up, and when the seizure comes to an end, the muscles relax, and they will start breathing normally again. So don't perform CPR, but you do need to call for help, so 911, if the seizure has lasted more than 5 minutes. So this is where timing it is important. Another seizure has occurred without the person coming to between the seizures. So if they have a seizure and they haven't woken up and kind of came about, and instead they just go straight into another seizure, call 911. The person appears to be choking. So if you have rolled them on their side and they still appear to be choking, call 911. This person has trouble breathing, call 911. The person is injured during the seizure, of course, call 911. This person asks for medical help, call 911. This person's, it may be the first seizure they've had, or you believe it is. That would be a reason to call 911, because you don't know why they are having a seizure. Is there something going on, as we discussed earlier? Could there be a malformation or a brain tumor that's causing that seizure? And the person is in water, like a bathtub or a swimming pool, definitely call 911. If any type of water. But I hope I helped you guys learn something. Thank you so much for listening to my speech.